now turn to questions from the media. And first up, I've got Paul Moulton of Isle of Man Television. Good afternoon, Paul.
Good afternoon. I'd like to return to the question of symptoms. It was some months ago we discussed headaches and how people were not having that on the list of the reason to get a test. Obviously, you've seen now that many countries are putting headaches on because of the Delta variant. Where are we up to? Because are we still slavishly following UK guidelines / European guidelines? Because even on UK commercial radio, the UK government is actually stating headaches as an item that you should be concerned about and go for a test.
I'll bring the Director of Public Health in, if I may, in a moment to answer that in more thoroughly than I can. But my understanding is we still follow the ECDC guidance. In relation to symptoms, Paul, I mean, if you look across health authorities across the world, there is an absolute plethora of symptoms that are recorded. I did a quick search after the last time, actually, we spoke about this at a press conference, and I think before I gave up, I'd come up with about 100 different symptoms that are listed across the world, across various health authorities. So it's a combination. So what we've tended to go for is the major symptoms as listed by ECDC, but I'll go over to Henrietta.
Thank you, Minister. That's absolutely right. The variation between countries and even between studies is huge. You'll know that the ONS study, which I think is where the source of the data that you're quoting at the minute, has actually flagged that headache and cough, I think, are the two highest prevalent symptoms. If you look at the results that were published last week from the Zoe app-based study, which is not a formal paper, it's just, originally it was a report on the BBC, then a YouTube clip from Tim Spector, who is the professor who's running it. There is now some data actually presented on the Zoe website, and that just ranks the symptoms that people reported on the app in conjunction with a positive test for COVID, and they've then split that down by vaccination status. So that shows that if you've got 2+2, you've completed your vaccinations, and you get infected, which we know a percentage of people will still go on to get infected despite vaccination, then you are more likely to have very non-specific symptoms like runny nose, sneezing, in addition to the others like headache, cough, and so on. The issue that you then get into is, did those people actually have symptoms that had been caused by their COVID, or did they have asymptomatic COVID, which you'd expect to see much more in the vaccinated, and therefore the symptoms were just casually related rather than causally, and could have been hay fever or something random. And the issue with headaches, of course, is headache is such a non-specific symptom, and so many of us have a headache at some point, and we have no data that actually allows us to see what the positive predictive value of headache is in terms of the conversion rate of people who have headache and actually go on to test positive for COVID. So it is very difficult. We do keep all of this under review with the COVID strategy testing group, which is largely public health and laboratory colleagues, but we also have regular review with our 111 clinical colleagues, and we take all this through the clinical and public health group to get the wider view on it. And it's quite a difficult call because, yes, on one hand, we want to keep testing to find cases. That was the case. Actually, as we move forward into living with COVID, do we actually want to go on doing that? Do we want to chase down cases to the nth degree, or do we not? And I think that's going to become clearer as we get to the point of having rolled out the vaccination programme. And we are in a kind of interim period for the next 2 months while we're sort of balancing the old scenarios and the residual risk that we do have in our population for transmission of COVID, while we still have a significant number of people who are not fully protected by vaccination. But once we get to the end of August and into September and we have that much stronger firewall, then actually we're probably not going to be so into counting cases. And in terms of actually surveillance, there is a call to be taken on, is it better to try and encourage people to come forward for surveillance by saying, more or less, any symptom you're concerned about, come and have a COVID test? Or is it better to say, actually, we won't do that, we'll leave the PCR testing to try and focus on the people who are most likely to have significant infection, which is not only more of a risk for them, but also more of a risk for transmission, and keep the grandstand service with capacity for them, but have other means of doing the surveillance around how much is this just out in the community. And at the moment, that might be about LFDs. Quite soon, and by late summer, autumn, I think it's going to be around the wastewater testing, because we have plans for that underway. So I think that's where we are at the moment.
So just to be clear, if someone's got a headache or sniffles or whatever, are you suggesting they shouldn't worry about it, or should they self-isolate and follow what the UK government is saying on these radio ads, that you should actually, keep away from other people, even if you've got any sort of symptom whatsoever?
I think that gets us to the point where we are likely to end up locking down the island again by default, which is quite clearly not in line with the mitigation strategy. So I don't think I would say that. I mean, obviously, if you know you have hay fever and you have a runny nose and a sneeze, the likelihood that that's positively predictive of your having COVID is very low. If you've got a headache, which of us hasn't had a headache over the last, say, 6 weeks? I think there you look for, is it a persistent headache? Is it a headache that's different to how you would normally experience headache if you're someone who tends to get them? And if you've got a reason for concern, always ring 111, because then you can have the clinical assessment and be advised whether testing's appropriate.
Thank you. My next question.
As a layman.
Yes.
For me as a layman, because I'm by no means a clinician or public health expert in any way, shape or form, but for me as a layman, it's about exactly what Henrietta just mentioned there, which is about continuing symptoms. If you have symptoms that are continuing longer than normal, you feel worried about them, then come forward for testing. That's what I would base it upon, whereas if you've got a headache, you take a couple of paracetamol and it goes away. Personally, I would say that's not quite as much of an issue, but if it's ongoing, then you should be coming forward. And I think that's the basis people need to take it on. But like I say, I'm just a layman in this area.
No, I think that's right. I think the key there is this something that's out of the ordinary for you?
Right, thank you. Dr. Alex Allison, please. I'll start this way, make your way to the podium. Hearing from many people about the situation where there's some school children that have been told to go home, isolate. Parents have been told to also isolate for 21 days. And these are parents who have had both jabs and they're plus 2 weeks. And they are, some of them, very annoyed because they thought this was to get past that situation. Am I reading this right? Is this still the policy, exactly like that?
Oh, yeah, well, thanks very much for giving me the opportunity to clarify this. First of all, children aren't being told by anyone to go home and self-isolate. As I said earlier, what we've done that's different this time is where we get a positive case in a school, we're using a far more nuanced way of contact tracing. So the contact tracers will go in, they'll identify particularly the friendship groups, and then ask them to self-isolate and get tested. Now, if they turn out to be positive, obviously they're then treated differently. So far with the contact tracing we've done both for the member of staff and for the initial case at St Ninian's, all the other friendship groups were negative, which is quite reassuring in some ways in terms of spread. So we haven't sent entire classes home, we haven't sent entire year groups home. And those that have been identified as high-risk people are asked to self-isolate for 10 days and will have follow-up testing. Now, I'd also like to take on board your comments about those who've been fully vaccinated. We have had a change in policy in terms of those people who are fully vaccinated, they will be obviously assessed by the track and trace system. If they are in a household with somebody who's been identified as high risk, because they've been fully vaccinated, they will not be expected to self-isolate. So what we're trying to do is concentrate on those people who may be at risk of having the infection or have already been identified of having the infection without disrupting all the rest of their households and the rest of the school environment. So this is a change. We are developing this because obviously, as Minister Ashford has said, we don't want to end up with lockdown by default. We're very aware of some of the situations in the United Kingdom whereby a large proportion, hundreds of thousands of school children are being kept out of school because they may or may not have been at risk. And so we're really trying to target this on those people who are most at risk and dealing with them very much on an individual basis rather than some blanket ban about coming into school.
And can you clarify, people can't keep their children off school? Because I've got another letter here saying that they've been penalised, it'll be counted as a strike, that they didn't send their children to school this morning because they were worried about any bringing home the virus. Is that the situation, that policy at the minute? You can't keep your children off school?
Okay, and again, thank you for letting me clarify this, because we're out of the state of emergency, so normal laws do apply, and our Education Act says, you know, you have a responsibility to send your child into school. I completely understand the nervousness at the moment about children in schools and the risk of infection. I mean, we have to remember the proportion of children who get seriously unwell is incredibly low. The statistics show from the UK over last year that the chance of somebody under the age of 18 developing coronavirus and dying was around about 1 in a million. This is a very low risk group, but I understand the concern from parents, particularly if their child has got some medical vulnerabilities, or they have as well. If a parent decides that they're really concerned, they don't want to send their child into school, please discuss that with your head teacher. Yes, they will be marked as absent, you're quite right. However, we as a department are not going to pursue you. We're not going to threaten to take you to court. We want to work with you to build up that confidence. But please have a chat with your head teacher, discuss your concerns, and we can work together for them.